So, good morning, everyone. My topic is all about lymphatic system. The lymphatic system are the tissues and organs that produce, store, and carry white blood cells that fight infection and other diseases. This system includes the bone marrow, spleen, thymus, lymph nodes, and lymphatic vessels, a network of thin tubes that carry lymph and white blood cells. So, what is lymph in the simple word? Lymph is tissue fluid, interstitial fluid that enters the lymphatic vessels. So, in additional, um, lymph is the clear fluid that travels through the lymphatic system and carries cells that help fight infection and other diseases, also called lymphatic fluid. So essentially, a drainage system accessory to venous system. So venous system is a system of organs that include the heart, blood vessels, and which is circulated throughout the entire body of a human or other vertebrate. Larger particles that escape into tissue fluid can only be removed via lymphatic system. So, function of the lymphatic system. Reabsorbs excess interstitial fluid. So, returns into the venous circulation, maintain blood volumes vessels, prevent interstitial fluid levels from rising out of control. Transport dietary lipids. So transported through lacteals drain into larger lymphatic vessels, eventually into the bloodstream. Lymphocyte development and the immune response. So components of the lymphatic system. So lymph or lymphatic vessels. So lymphatic vessels include lymphatic capillaries, lymphatic vessels, lymphatic trunks, lymphatic ducts, lymphatic organs, thymus, lymph nodes, spleen, tonsils, and lymphatic cells, lymph vessels. Lymphatic capillaries also. Lymphatic capillaries are tiny vessels that collect and filter fluid from your body cells and tissues. They help to maintain blood pressure and volume and prevent fluid buildup. So, lymph or lymphatic capillaries are tiny, thin-walled vessels, close at one, and are located in the spaces between cells throughout the body, so except the central nervous system and non-vascular tissues. Lymphatic capillary are slightly larger in diameter and have greater oncotic pressure than blood capillaries. Lymphatic collecting vessels collect the filter lymph at the nodes. So as it continues to move toward larger vessels called collecting ducts. So these vessels operate very much like your veins do. So they work under very low pressure, have a series of valves and them to keep the fluid moving in one direction. Lymph collecting vessels located lymph capillaries are found between cells in the interstitial space. So these capillaries are in the tissues of every organ in your body except for your avascular tissues, meaning body tissues without blood vessels. Next, lymphatic trunks. So small lymphatic vessels join to form larger tributaries called lymphatic trunks, which drain large region. Lymphatic trunks merge until the lymph enters the two lymphatic ducts. So the right lymphatic ducts drain lymph from the upper right quadrant of the body. So that thoracic ducts drain all the rest. So a lymphatic trunk is any large lymph vessels that forms from the convergence of many efferent lymph vessels. So there are four sets of lymph trunks that are paired with a right and left half and one unpaired trunk. Jugular lymph trunks located in the neck drain lymph fluid from the cervical lymph nodes of the neck. Next, lymphatic ducts. So lymphatic vessels collect and filter lymph at the node. So as it continues to move forward, larger vessels called collecting ducts. So these vessels operate very much like your veins do. So they work under very low pressure, have a series of valves in to keep and fluid moving in one direction. So, lymphatic ducts form interstitial fluid is collected by lymph capillaries from the interstitial space. So, lymph then moves through lymphatic vessels to lymph nodes. Lymphatic vessels merge to create the lymphatic ducts, which drain into the venous system. So, next. So, this is from lymphatic capillary to lymphatic vessels, lymph nodes, lymphatic vessels, lymphatic trunk, collecting duct, and subclavian vein. So lymphatic capillaries, so features of structure, blind end. So there are single layer of overlapping endothelial cells, then more firmable than that of blood capillary, absent from avascular structures, brain, spinal cord, splenic, pulp, and bone marrow. So lymphatic capillaries have a thin walls, only as thick as a single cell. So the cells overlap each other so that interstitial fluid easily enters the capillaries. Lymphatic capillaries are closed at one end. They contain mini valve that lets interstitial fluid flow into but not out of them. So the important feature of lymphatic capillaries is fluid pressure regulation. So lymphatic capillaries collect lymph fluid from the tissues, which allow them to regulate the pressure of interstitial fluid. So this fluid is essentially plasma that leaks out of cardiovascular capillaries into the tissue due to the forces of hydrostatic or encotic pressure. So what is hydrostatic or oncotic pressure? So the main difference between hydrostatic and oncotic pressure is that hydrostatic pressure is the force that pushes the fluid out of the blood capillaries, whereas oncotic pressure is the force that pushes the fluid into the blood capillaries. So, oncotic pressure example. So, example of this include the brain and kidney. So, which are encased by rigid bone, brain, or by a capsule kidney. So, in contrast, soft tissues such as skin, muscle, and lung have a high compliance, and therefore the interstitial space can undergo a large expansion with a relatively small increase in pressure. So next. So lymphatic capillaries lacteals. The small intestine contains special types of lymphatic capillaries called lacteals. So why they called lacteals? So there are blood capillaries and special lymph capillaries. called lacteals. In the center of each vilus, so the blood capillaries absorb most nutrients, but the fats and fat-soluble vitamins are absorbed by the lacteals. So the lymph in the lacteals has a milky appearance due to its high fat content, and it's called chyle. Lacteals pick up not only interstitial fluid but also dietary lipids and lipid-soluble vitamins. So the lymph of this area has a milky color due to the lipid, and it's also called chyle. So lymphatic vessel features of structure. So there are three-layered wall but thinner than vein. So more numerous valves than in vein, interposed by lymph nodes at intervals, arranged in superficial and deep sits. So lymph or lymphatic vessels are thin-walled valve structure that carry lymph. Lymph vessels are lined by endothelial cells and have a thin layer of smooth muscles and adventitia that bend the lymph vessels to surrounding tissue. So lymph tracts. So right and left jugular trunks, right and left subclavian trunks. Then right and left bronchomediastinal trunks. Then right and left lumbar trunks and intestinal trunk. So this is the example of lymph trunks. They're like right jugular trunk and left jugular trunk. Then right subclavian vein, right bronchomediastinal trunk, and left bro- bronchomediastinal trunk. Then followed by right lumbar trunk and left lumbar trunk. Then right lumbar trunk, then intestinal trunk. So lymphatic ducts. So let's proceed to lymphatic ducts. So right lymphatic duct. So formed by union of right jugular subclavian and bronchomediastinal trunks. So what is bronchomediastinal tract? So why we called bronchomediastinal trunk? So bronchomediastinal lymph trunks are large efferent lymphatic channels draining into the venous system within the neck but originating within the mediastinum. So the sources of lymphatic which run into the bronchomediastinal trunks include external, internal, thoracic nodes, and tracheobronchial lymph nodes. So ends by entering right venous angle, as what I've said. So lymphatic ducts, thoracic duct. So what is thoracic duct? Begins in front of L1 as a dilate sac and cisterna cycli. So formed by left and right lumbar trunks and intestinal trunk. Enter thoracic cavity and ascends. Travels upward, veering to the left at the level. So thoracic duct at the root of the neck. So in terms of laterally, so arches forward and descends to enter the left venous angle. So before termination, it receives the left jugular subclavian and bronchomediastinal trunk. So from this, so drainage pattern. So area drained by the neck right lymphatic duct, and area drained by thoracic duct. So right lymphatic duct receives lymph from right half to head, neck, thorax, and right upper limb, right lung, right side of the heart, right surface of liver. Thoracic duct drains lymph from lower limbs, so pelvic cavity, abdominal cavity, left side of thorax, and left side of the head, neck, and left upper limb. So lymphatic cells, also called lymphoid cells, located in both a lymphatic system and the cardiovascular system, work together to elicit an immune response. Types of lymphatic cells are macrophage, epithelial cells, dendritic cells, lymphocytes. So, what is macrophage? Macrophages also are a type of white blood cell that play an important role in the human immune system and carry out various functions including engulfing and digesting microorganisms, clearing out debris and dead cells, and stimulating other cells involved in immune function. Then, epithelial cells are type of cell that cover the inside and outside of the surface of your body. So there are found on your skin, blood vessels, and organs, including your urinary tract. So, what does it mean if my epithelial cell are high? So, if urinalysis results show a moderate or high number of epithelial cells, it may indicate the following medical condition. So kidney disease, liver disease, yeast infection, urinary tract infection, certain types of cancer in addition. So the type of epithelial cell in the urine can also signal certain disease. So a special type of immune cell, so that is found in tissues such as the skin, the boost immune responses by showing antigen on its surface to other cells of the immune system. So a dendritic cell is a type of phagocyte and a type of antigen presenting cell. So lymphocytes, so a form of small leukocytes, a white blood cell with a single round nucleus, so occurring especially in the lymphatic system. Next, so lymphatic organs, primary organs. So there are red bone marrow and thymus glands. The secondary organs, lymph nodes, lymph node, nodules, spleen. So then lymph nodes. So in the lymph nodes, we have thoracic cavity nodes. So then cervical nodes, axillary nodes, supratrochlear nodes, abdominal cavity nodes, pelvic cavity nodes, and inguinal nodes. So a small run of oval, so they are located along the pathways of lymph B cells. So length from 1 to 25 millimeters, then typically found in clusters and receive lymph from the mini body region. Lymph nodes are also found individually. So lymph node features bean-shaped bodies with inferent vessels entering at the periphery and inferent lymph B cells emerging at the hilus, arranged in groups along the blood vessels or the flexural side of the joint, divided into superficial and deep group. So regional lymph drainage. So regional lymph node is the lymph node where the lymph of the organ or part of the body drainage to firstly sentinel lymph node. So as what you can see in the picture, it is our boobs. Spleen location. left epigastric region between 9 to 11 rib, in line of 10 rib, largest lymphatic organ in the body, so can vary considerably in size and weight function. So thymus features consist of two elongated lobes and a large organ, and the fetus occupies the thoracic cavity behind the sternum, secrete lymphopoietin, lymph nodules. So oval cluster of lymphatic cells with some intracellular matrix that are not surrounded by a connective tissue capsule. Then filter and attack antigen. Then in some areas of the body, mini lymphatic nodules group together to form larger in structure. So mucosa associated by lymphatic tissue or mold or tonsils, what we call tonsils, very prominent in the mucosa of the small intestine, primarily in the ileum. Pair patches also present in the appendix. So malt um, stands for mucosa associated lymphatic tissue. So pairs, patches, tonsils, and appendix digestive tract. So lymphoid nodules in the walls of the bronchi respiratory tracts. Mouth protects the digestive and respiratory system from foreign matter. Tonsils. Clusters clusters of lymphatic cells and extracellular matrix not completely surrounded by a connective tissue capsule. So consist of multiple germinal centers and crypts. Then several group of tonsils form protective ring around the pharynx. Then pharyngeal tonsils or adenoids in nasopharynx. Palatine tonsils in oral cavity, lingual tonsils along posterior one-third of the tongue. So mouth mucosa-associated lymphoid tissue, lymphangitis, inflammation of the lymph vessels, commonest caused by bacteria called Streptococcus pyogen, most of common. So lymph vessels appear as red streaks through the skin. So kanang mura siya og kanang mga ugat nga mga nag-red. So, filariasis. So, microfilaria from the infected person enter the mosquito in a blood meal. Then, after that, microfilaria develop into infective larvae and the mosquito and are injected into a new host. Then, after larvae mature into adult worms and spread through the lymphatic vessels where they mate the lay eggs. So example of this, so mosquitoes where if they bite of your skin, so daghan kay nahitabo no nga magkakos siya og dengue. So lymphedema. So occurs due to accumulation of lymphatic fluid in the interstitial issue, sometimes can be appreciated after wearing tight cloth of jewelry on affected limb. So example of that, kung ang imong skin or magkuan ka or imong singsing na madugayan na siya sa imuhang sa imong tudlo. So if dugay na siya nimo dili kuhaon, sumuburot jud to siya, sumudako because dili na ning hugot ang singsing. So lymphadenopathy, so means a disease of lymph nodes. So lymph nodes become swollen, enlarged, and may be painful of touch. So mura siya og bayuok. So lymphomas, cancers originating either from the lymphocytes in the lymph nodes of the lymphatic tissue in organs. So risk factor. So example of this is HIV, mura siyang mga virus, hepatitis, EBV infection. Then tonsillitis, infection of these pharyngeal tonsils. Tonsils are swollen, fever and pain. So magkakos siya og fever and pain during swallowing usually present. So treatment, surgical removal of tonsils, tonsillectomy. Then splenomegaly, enlarged spleen, various causes. So these are the example. So before, normal spleen. Then splenomegaly, so nadaot siya pagkahuman or ning dako. So that's all my report.